Hi, it's Ramey, your man in the middle. I'm back, and we're discussing how immigration, both legal and illegal, affect the healthcare systems or universal healthcare. Nobel Prize-winning economist Milton Friedman, who is widely considered the most influential economist of the 20th century, he's often quoted. He has a quote that he says, it says, "You cannot simultaneously have a welfare state and free immigration." What he meant was fairly straightforward. If the country has generous taxpayer-funded social programs completely open to immigration, could create the incentives for people to move in order to get those benefits. And some would say that's what's happening right now in the United States. But an important detail often gets lost when people quote Friedman, uh, and that is that during the mid to late 20th century, Friedman was not entirely convinced that illegal immigration, oddly enough, was necessarily harm to the economy. At times, he argued, undocumented immigrants often came primarily to work rather than collect benefits. So the question is purpose. If we're getting immigration and people are coming here to work and they get to work, then it does benefit the economy. But under our current system, if they're getting here and we're providing welfare benefits in addition to healthcare benefits, then I can't see a scenario where that's helping the economy, and I can't see where that can maintain for long periods of time with the way our tax structure works. And so what he didn't imagine was a system where state and local governments, for example, right now, might provide extensive welfare benefits, housing assistance, or healthcare coverage to a large number of people without legal status. The distinction matters because the immigration debate today often mixes together several issues: how many immigrants should be admitted, how immigration should be regulated, and how generous the local safety net should be for people who arrive. The impact on the healthcare system is complicated. Many studies show that immigrants, especially recent arrivals, tend to be younger and healthier than native-born population when they first arrive. Researchers often refer to them as the healthy immigrant effect. Because of that, immigrants often use fewer healthcare services in their early years. And in some analysis, the per-person healthcare spending among immigrants is significantly lower than for US-born citizens. Again, that is excluding any other welfare benefits they may receive. Immigrants also play a major role in the healthcare workforce itself. A substantial share of doctors, nurses, and healthcare workers in the United States are foreign-born. In many rural and underserved communities, immigrant medical professionals are essential. At the same time, critics will point out that some immigrant households rely heavily on public assistance programs such as Medicaid, food assistance, and housing support, particularly when immigration involves large numbers of lower income households. There are also complex eligibility rules. Many immigrants are not eligible for federal benefits for several years after arriving legally, and undocumented immigrants generally are barred from most federal welfare programs, technically. However, they still may receive emergency medical care and may qualify for certain state and local services depending on where they live. In practice, though, I think what we're faced with is the strain on the healthcare system often appears locally rather than nationally. Border regions, safety net hospitals, emergency rooms, and clinics that serve low-income populations face much more pressure as migration increases quickly. That's something we're going to cover in our conclusions about the pace of immigration. At the same time, those healthcare systems often rely heavily on immigrant workers to function. The relationship between immigration and healthcare is therefore complex. Immigration can strengthen our healthcare systems through labor and tax contributions. Rapid migration combined with poverty and policy gaps can provide localized pressure in public services. We're going to wrap this all up, hopefully, with some conclusions. As to this point, you notice I haven't really given my personal opinion, but we'll get into that in the next session.